Today we will talk about Quality Improvement Initiative Proposal, Reducing Hospital Readmission, Enhancing Patient Outcome Through Data-Driven Strategies. Greetings to all. I'm going to discuss a quality improvement project that aims to lower hospital readmissions, a problem that has an impact on both patients and outcome and healthcare expenses. Introduction to the health issues. When a patient returns to the hospital within 30 days of being discharged, it is known as the hospital readmission. High readmission rates can have detrimental effects on patients' outcome and are a sign of possible gaps in care. Readmission to hospitals provides serious problems for the medical field. They may result in higher rates of morbidity or mortality, as well as greater expenses for healthcare system and patients alike. Our objective is to identify the causes of these rates and put an initiative in place to lower them. Data analysis overview. Dashboard matrix review. 30-day readmission rates, patient characteristics, combined condition, matrix for discharge planning. We examine our facility dashboard indicators, paying particular attention to the 30-day readmission rates. In order for trends that might guide our effect, we also took patient demographics and comorbidities into account. Finding and evaluation of data quality. Concurrent readmission rate 20% over the 15% national benchmark. High-risk demographics. Patients 65 years of age or older and those with long-term illness. Data quality assessment, dependable data sources, and regular reporting intervals. At 20%, our readmission rate is concurrently much higher than that 15% national average. Targeted interventions are necessary as the research suggests that individuals with chronic disease and the elderly are most vulnerable. Proposed QI initiative. Initiative title Program for Enhanced Discharge Planning. Objectives within year, cut the 30-day readmission rate by 25%. QI model. PDSA stands for Plan to Study Act. Our suggested program, called the Enhanced Discharge Planning Program, aims to cut readmission by 25% in the upcoming year. The PDSA program will be employed to methodically execute and assess our strategy. Target areas for improvement. Key focus area: enhanced instruction for patients, setting up follow-up appointments, recollection of medication, resources for assistance, community service, home health. Improving patient education at the time of discharge, making sure follow-up appointments are made, thoughtfully recording medication, and putting patients in touch with the service they need for support are some of our main focus. Evidence-based strategies to implement, teach-back techniques for educating patients, uniform checklists for discharge, collaborating with community health service, utilizing telehealth to monitor. Evidence-based techniques will be used, including the teach-back techniques to make sure the patient understood standardized discharge checklists to make sure nothing was overlooked, and community service coordination to provide ongoing support. Interprofessional collaboration. Key stakeholders, the physicians and nurses, social workers inform, roles and responsibility, nurse planning for release and patient education, doctor coordination of care and follow-up, social worker linking of resources, inform medication administration. Various healthcare professionals must work together to achieve our goal. Social workers will connect patients with resources. Doctors will oversee treatment coordination. Nurses will oversee patient education. And Inform will successfully handle prescription administration. Communication tools. Tools to facilitate collaboration. Recurring multidisciplinary team gathering. Electronic health records shared among patients. Methods of monitoring patients. We will use patient monitoring techniques to track results. Shared electric health records for real-time information exchanges and regular interdisciplinary team meetings to foster effective collaboration. Conclusion and call to action. Expected outcome: lower rates of readmission, enhanced contentment among patients, improved coordination of care. Next step: acceptance of the projects. Modeling resources pilot phase of deployment. To sum up, our suggested programs speaks to improve patient care and satisfaction while dramatically lowering readmission rates. I implore everyone to provide their support and help put this ideal into action. I appreciate your time and your interest, and I eagerly await your inquiries and your comments. Thank you.